Good morning, everyone. Welcome to the Greater Washington Urban League's On Track radio broadcast. I'm Roland Turner, your host. This morning, we've got a very exciting show. It's a series that the Greater Washington Urban League is conducting, and it's all about COVID-19 contact tracing awareness program, as well as the COVID-19 and how it's affecting the Black community. I'm also so excited because I have a wonderful guest host in the studio this morning with me once again. I have Xavier Snow, and he is the project coordinator of this program. And Xavier is going to host the program once again this morning, so I will continue to listen, as I'm sure you will, and we will learn all about COVID-19 and contact tracing. Take it away, Xavier.
Thank you, Roland, for that superb introduction. Now, before we officially begin today's broadcast, I would like to tell you a little bit more about the Contact Tracing Awareness Program. The Contact Tracing Awareness Program, or CCTAP for short, is brought to you by the Greater Washington Urban League and is designed to help the Black community identify and respond effectively to contact tracers. Through a series of blogs, workshops, podcasts, and broadcasts like the one we will have today, we distribute the information throughout the city in numerous and helpful ways by partnering with nonprofits, churches, and other community staples. Consequently, a major outcome of the program will be to provide participants with resources to obtain up-to-date information, as a greater understanding of the virus could result in the continuous development of whole new sets of strategies. Care First Blue Cross Blue Shield Community Health Plan District of Columbia has agreed to partner with the Greater Washington Urban League in the development and implementation of the COVID-19 Contact Tracing Awareness Program. As a premier Washington, D.C. based managed healthcare organization and provider, Care First's task is to ensure that individuals and their families are enrolled and receiving Medicaid or Alliance benefits. Now, without further ado, let's begin today's broadcast.
Our guest today is George H Lambert Jr. of the Greater Washington Urban League. I am really fortunate for the opportunity to speak to such a distinguished guest and gain his perspective on COVID-19. If you don't mind, sir, please briefly introduce yourself and your background.
So, Xavier, delighted to be here. An excellent Sunday morning to you and certainly to all of our listeners joining this morning. Let me begin by saying that this is a very defining moment in our country. It is a moment in our country where we're certainly, I think, responding to two pandemics. And, of course, the pandemic of COVID-19, and then the pandemic, I would say, of systemic racism. And clearly really defines a lot of the work that the Greater Washington Urban League is involved in as well. So what I will tell you about me, and of course about the Greater Washington Urban League, is that I stand on the shoulders of our ancestors, particularly in the time that we're living in now. I stand on the shoulders of our ancestors who certainly suffered through man's inhumanity to man, meaning slavery, who certainly suffered through Jim Crow, who certainly suffered through gaining the right to vote, and now still responding to, as I mentioned earlier, the two pandemics of today. So that is who I am. That is the work that I and the Greater Washington Urban League is about. So that's why I'm here today.
Absolutely, absolutely. So you mentioned that we're living through two pandemics right now, COVID-19 and systemic racism. As someone who has put themselves on the front line for a community for over 40 years, how does what we are going through now relate to all that we've been through in the past with civil rights, segregation, and the like?
Well, as I mentioned earlier about our ancestors, we cannot despair in this particular time over the enormity of the burden before us. This is the time for us to really kind of get back into the trenches, and for those of us who've been in the trenches to continue to stay in the trenches in responding to this issue.
For those people who don't already know about the Urban League, can you please share the background of the Urban League as relevant in our community, as well as some resources offered today to help people get through these challenging times?
So, we are a civil rights social service organization. I would dare say that At our core, we are a civil rights organization. We operate at the tip of the spear. We are, to the community that we serve, we are the counselor, the protector, the defender, and more importantly, a trusted voice in the community that we serve. So, in saying that, we have an obligation to really define as well as articulate those issues that are a concern to our community. COVID-19 is an issue that is of major concern to our community. And although I know I'm not necessarily here to talk about it today, but certainly systemic racism as well is of major concern to our community. So the Greater Washington Urban League and the Urban League movement, we are deeply involved, deeply engaged in those issues.
Coronavirus has undoubtedly affected the entire economy. One area hit extra hard by this has been employment. With millions of Americans filing for unemployment every week, it now becomes more important than ever to be financially aware and fiscally responsible. How does someone already experiencing financial hardship pre-COVID navigate these difficulties that don't seem to be going anywhere anytime soon?
Interesting question. The new jobless claims numbers were just released and really kind of identifying first-time filings for many unemployed folks who are really filing now for unemployment insurance benefits. Clearly, again, underscores the tremendous need that's occurring at this point. We all know that folks of color, African Americans in particular, have been hit dramatically hard with this pandemic. Many of the jobs that we had, those jobs are not going to come back. So it really drives the need for ensuring that folks are able to pivot in some extent, and then to ensure that even those who are not necessarily able to pivot, certainly how we can help to put them, I will say, in jobs to temporarily help to, just really kind of get them through this pandemic that we're going through.
As contact tracing awareness is one of the new issues that the Greater Washington Urban League is addressing, can you please talk a bit more about the goal of this project and the role of the Urban League as facilitators?
So I think this is clearly some of the very meaningful work that we're engaged in. I think it's meaningful work in one context because I will dare say that there are bad actors out there, so to speak, who are not necessarily taking this serious. And we have to make sure that, this issue is really taken very serious. This is not hyperbole. This is a very serious issue. I remember commenting several months earlier with the mayor that she was taking a very measured approach in terms of ensuring and keeping the residents of the District of Columbia safe. When you still kind of look at the statistics, even though we're several months in at this point, African Americans in particular are getting hit very hard, probably harder than any of the other communities in terms of COVID-19. So this is very important and purposeful work that the Greater Washington Urban League is doing.
Absolutely, absolutely. Now, is there any final words that you would like to leave this audience with today?
Well, so let me just say this, and this is kind of given the times that we're in. In 2008, when President Obama was elected, the country was really in what I would dare say is we were very euphoric about it. There was folks were excited about it. But, I would also very quickly say that it was not the final victory over racism in our country. And nor was it the final victory over the dark veil of neglect in our country, nor was it the final victory over indifference in our country. And again, once again, the times that we found ourselves in, we are still fighting and facing all of those issues. So my final word is that our ancestors, as I started out by saying in this interview, we still stand on the shoulders of our ancestors. Our ancestors suffered through worse, okay? Our ancestors suffered through worse. So we will stay at the tip of the spear and we will fight through this as well.
Well, Mr. Lambert, I just want to personally thank you for taking the time to speak with the people. We appreciate what you and the league are doing, and hopefully we continue this for many years.
Thank you. Delighted to be here.
Our next guest today is someone I admire dearly, not only from a professional standpoint, but as a genuine human being as well. We originally met a few weeks back at a COVID-19 outreach event in Lincoln Heights, which, for those of you who don't know, is a predominantly and historically black neighborhood located in Ward 7 in Washington, D.C. I was fortunate to be hired as a videographer during the event, while she was doing her thing, interacting and educating the people on COVID-19 symptoms. We connected instantly, and I knew I had to have her on our show.
It is with the utmost pride and sincerity that I welcome today's next guest. Not only is she a physician leader, content creator, epidemiologist, TED Talk Mid-Atlantic speaker, and a member of the National Academy of Science Roundtable on Health Literacy, she is also a phenomenal Black woman. Ladies and gentlemen, Dr. Lisa Fitzpatrick.
How are you doing today?
I'm great, Xavier. Thank you for having me.
Oh, it's my pleasure to have you here today.
That was a really nice introduction.
Only the best for you, okay?
Okay.
I remember back in March sitting at home scrolling through Facebook and seeing these quote-unquote scientific studies floating around that Black people couldn't get COVID due to our genetic composition. At the onset of this pandemic, many people, especially on social media, fueled the idea that Black people could not get this disease. We now see this as the farthest thing from being true. Since then, Black people have died from the virus at a rate of 50.3 per 100,000 people compared to a rate of 20.7 for whites. At more than double the death rate as whites, across the board from city to city, the Black community seems to be the most affected by the pandemic. Dr. Fitzpatrick, please touch on some of the myths around COVID-19, especially as it pertains to the Black community.
Thank you so much for bringing this up. I think the myth you just mentioned is the one that was most concerning at the beginning of the epidemic. This myth started out as a joke that Black people could not get coronavirus. But soon after, we realized that Black people were dying at higher rates than white folks. So I think people now recognize that this is something we have to take seriously. I also think some of the myths around treatment, around the vaccine, there are myths related to 5G. This is one I hear commonly, and so we can talk about that a little bit.
Right.
There's a notion that coronavirus can be transmitted by 5G towers. So it depends on who you talk to. Right. The myths take on a variety of forms depending on who's talking about it and who they're talking to. So at the beginning of the pandemic, I heard people asking if it was really true that coronavirus could be spread through 5G towers. There's no evidence of that. So after talking to enough people, I heard there's another version of this myth. Okay. And it's not so much that coronavirus is being transmitted by 5G. It's linked to the distrust of government. So the gentleman said to me, well, no, we don't think it's transmitted. We think they're using 5G, they're using coronavirus as a distraction so they can move the 5G technology forward. And when I asked him what he meant by that, he said, well, the community is not very supportive of the 5G technology coming to our neighborhoods. So when have you seen the government scare people into staying in the house? The streets were empty. It's because they wanted to put up those 5G towers. So I think a lot of the myths, they are a result of lack of accurate information, and this stuff can be very complex.
Right.
So I'm not surprised that people don't understand everything, but it's like playing the game of telephone. So when this joke started, Black people can't get it, and then it continued to be passed around in the community and on social media, it took on a life of its own. Someone took it seriously, and that's when people started to wonder, oh, well, maybe we're not getting it. People also thought that because early days, the people we saw who were getting tested, I think Tom Hanks was one of the first ones. So they were seeing people who were not Black talking about having coronavirus. But there was a basketball player, I think Idris Elba also came out and said, look, I have coronavirus. So slowly, We've been deconstructing those myths, but there's still plenty out there.
As I first began my research for this project, I had to complete a course on contact tracing, a topic we will touch on before the end of this broadcast. In the middle of this course, there were several updates sharing new information about our understanding of this virus. It seems as though with this being the novel or new virus, there is so much we have yet to learn on this issue. As a medical professional, can you briefly discuss the origin of this disease and how we have come to understand it today?
That's a great question. So first of all, we have heard of coronavirus before. Coronaviruses are very well known to us because they generally cause the common cold. The problem is in any virus family. So just take your family, for instance. You have cousins, you have second cousins and distant cousins that you don't even know about. So viruses, bacteria, they have the same thing. They have distant cousins. Let's just, to keep it simple.
Okay.
So the coronaviruses we knew about behave in a certain way. You come in contact with coronavirus, somebody sneezes or coughs on you, or the same things we're telling people to prevent coronavirus, that's how the other coronaviruses are spread as well. The challenge is this coronavirus is not acting like the coronaviruses we knew. So it's not that coronavirus is showing up for the first time ever and we've never heard of it. We haven't heard of this coronavirus because it's a different strain, but it's still within the coronavirus family. There's still some things we don't know about. We know a lot about its transmission. We know that it's mostly transmitted through what we call respiratory droplets. So if someone sneezes or coughs and it gets on you or it comes in contact with your nose or your mouth somehow, you can get it. So that's largely how it's spread. Right. But there are some unknowns about the way it seems to behave because some people don't have symptoms. And that's very unusual. Mm. The other thing is it seems to spread a lot easier between people than the other coronaviruses. So if you put all this together with all the other unknowns, well, how should we treat it? Because we generally don't treat coronaviruses. Like we don't have a pill for the common cold. Mm. But now we have to come up with treatments because this coronavirus is making some people so much sicker. So I think we know a lot more now than we knew. People were dying a lot at the beginning of the pandemic because it was not behaving the way most viruses behave. But over time, and unfortunately, over 200,000 people have died, and we have millions of infections. But that also is an opportunity for us to learn how this virus behaves, who's most affected by it, and why. So there's still more to learn, but we still know a heck of a lot more than we knew in March.
One of the methods for addressing this disease that the League is currently involved in is contact tracing. Can you talk about the topic briefly? What is it and why should people care?
Contact tracing. So let me talk about something people might be more familiar with. If you've ever had a sexually transmitted infection, or you've heard someone who's had a sexually transmitted infection, so I'm talking about chlamydia, gonorrhea, HIV, these are infections that are reported to the health department. Tuberculosis is another good one, and probably one that people would probably rather relate to. So let's talk about tuberculosis. If you find out you have tuberculosis, you're diagnosed by your doctor or a hospital or a lab, that information goes to the health department, and they spring to action because tuberculosis can be spread to someone else. Mm. That creates a public health concern. Mm. So when that happens, this is when contact tracing becomes relevant because we need to figure out who else the person with tuberculosis has been around so that we can go find those people, test them to see if they might also have tuberculosis and continue doing that. So let's say I have tuberculosis. I get diagnosed with tuberculosis, but I came to your office today. I was coughing. We didn't think anything about it. and I find out I have tuberculosis, the health department will ask me, who have you been around? And I'll say, well, I was around Xavier. So then they will contact you to say, we understand that you came in contact with someone who has tuberculosis, and we want to get you checked out. Number one, we can prevent you from getting tuberculosis. But number two, if it turns out you have tuberculosis, we can treat you so that you won't infect someone else with tuberculosis. Okay. Does that make sense?
That does make sense.
Take that, change tuberculosis to coronavirus.
Okay.
It's the same thing. So this is not a new process. Right. It is an age-old process that we have been using for decades. This is how you interrupt the spread of infectious diseases. So where we went wrong in the United States is when this virus first came to our shores. First of all, we weren't on guard to be aggressively looking for it, testing people, and conducting contact tracing. But that's what ideally would happen. If we knew about the cases, we would have used whatever resources were necessary to identify people who had come in contact with the person who had coronavirus, and then figured out where they had been. In this case, I think it was someone who had flown from overseas. So in that case, they probably, and I hope they did, I don't know, tested everybody who was on that flight. So this is a very common public health process that we use to stop the spread of infectious diseases.
Thank you, Dr. Fitzpatrick. Some very valuable information has been shared during this time. With that being said, is there a final message you would like to share before we sign out?
Well, first, I want people to ask questions. I believe people need to be informed so that they can make good health decisions. And right now, trusted health information is kind of in short supply. So it's hard for people to figure out who they should be listening to. And despite all the conflicting health information, I think people should still be listening to the national public health authorities, CDC. People have come to listen to Dr. Fauci. He's a very good source of health information around this pandemic. And finally, I want people to know that I'm in a vaccine trial. And the reason I'm in the vaccine trial is because we believe one of the strategies to end this pandemic is to develop and disseminate a vaccine. But in the Black community, we have a lot of distrust in general around vaccines. So I decided to enter the study so that I could show people and help them understand the process. This is not politics. This is science. And clinical trials and vaccine trials, they've been going on for decades before this pandemic came along. And so we have to help people understand that, yes, this is a scientific process that has safeguards to protect people. This is not like Tuskegee. This is not like using information like they did with Henrietta Lacks. This is not that. We have been conducting clinical trials and research with informed consent. So we tell people up front, this is what's going to happen. And you're volunteering. You don't have to participate. And even if you choose to participate, you can exit at any time. So I want people to be clear about that this is not like Tuskegee. So I think in the Black community, despite the distrust from what happened in the past, we don't want to be left behind. I think it's Dr. Reed Tuxen. I don't know if people know him, but I had a conversation with him, and his concern was if we don't, quote unquote, get over Tuskegee and move forward, we're going to be left behind. And while everyone else is vaccinated, the Black people will be walking around wearing masks. So just something to think about. So get the information you need. If you're uncomfortable, you don't trust the sources, then keep looking. And people can certainly contact me. Go to our website, Grapevine Health, like I heard it through the grapevine. Grapevinehealth, one word.co, and send me a message, and we'll try to get people the information they need.
So many interesting topics were covered in today's broadcast on COVID-19 and the Black community. I really wish we had more time, but unfortunately, we have to go on about our day. We touched on everything from systemic racism and financial hardships with Mr. myths around COVID that aided the uncertainty of many Black people and the overall effectiveness of contact tracing with Dr. Lisa Fitzpatrick. Both of these experts in their respective fields agree this is not something to take lightly by any means. One thing's for sure, this virus likely isn't going anywhere anytime soon. However, if we arm ourselves with the correct knowledge needed to protect our family and our neighbors, we can begin to fight back effectively. Only then will we begin to see the changes required to offset the pandemic. Until then, we must continue to practice social distancing, wear our mask in public, and wash our hands frequently. Another special thank you to our wonderful guest, George H. Lambert Jr., President of the Greater Washington Urban League, and the phenomenal Dr. Lisa Fitzpatrick of Grapevine Health. It was an absolute pleasure to host this show with these wonderful people. This is your guest host, Xavier Snow of the Greater Washington Urban League, signing out. Until next time, remember, stay positive, stay blessed, and stay COVID-free. Peace out.
Wow, that was incredible. As this show ends, I learned so much about COVID-19 and contact tracing. I want to thank our guest host, Xavier Snow, for hosting the show this morning. And on behalf of the entire Greater Washington Urban League staff, our president and CEO, George H. Lambert Jr., and yours truly, your executive producer and host, Roland Marie Turner, we thank you for listening to On Track on WPGC Radio. On Track is a community service of WPGC Radio and the Greater Washington Urban League. We welcome your comments as well as your praises. Look us up on www.gwul.org. That's www.gwul.org. Once again, I'm Roland Turner, and please have a productive day.